My guest today is Dr. Theresa Feller. She is a veterinarian at the San Angelo Veterinary Hospital. Thank you for coming.
You're welcome.
What inspired you to become a vet? And before you say, every guest that we've had in here and I ask them about dogs, the first thing they'll say is when they were little, they wanted to be a veterinarian. So I'm just curious to see if an actual veterinarian wanted to be a veterinarian when she was a kid.
I always liked animals growing up, and then I kind of liked the math and sciences when I was in school. Mm-hmm. So that was my goal, and I applied, and if I wouldn't have got in, I don't know what I would have done. Mm-hmm. But I got in, and so I continued on, and 10 years today.
So you're all around. The job is for you. The animals, the science, math, everything.
Mm-hmm. Yep.
That's awesome. And that's just always been your...
Yeah.
Have you always been here in San Angelo?
I grew up in South Dakota mostly. My mom's parents had a ranch with some cattle, and then the neighbors had cats and chickens and pigs and all this stuff. So I enjoyed going over there and helping out and then seeing all the little calves. And we had dogs and cats growing up.
A little bit of everything right there. Was there somebody that you looked up to in the field, or you just went into it? Do you have a mentor?
My stepdad has a cousin that's a vet. My mom and stepdad got married when I was, I think, a senior in high school. Mm-hmm. So I was kind of already on the track to do the pre-vet college requisite stuff, and then she came along, so I spent a summer with her out in Colorado and got to see a lot of different vets she knew doing specialty things, surgeries or dental stuff or all sorts of stuff, and just kind of solidified me going into the field. And then I did do a couple internships or volunteer things growing up too with the local clinics, large animal and the small animal stuff too. Nothing deterred me.
I hear that there's a lot of schooling involved. What was that like?
There is a lot. You have to do a minimum of 4 years of college. A lot of places have a pre-veterinary type program, but usually it's a biology type major or chemistry type major. Mm-hmm. And then you apply. You have to take where I went, you had to take a GRE. I think some other places have some other big test you have to take to qualify to get into vet school.
So this is all before you even...
Yes. Yeah. You usually need some kind of degree or at least several credits. Then you take a special test, and then some schools require interviews if you get selected. Most do nowadays, and then you have to go to the school to get interviewed before you're even accepted. Mm-hmm. You have to have all the credits, have decent grades. You don't have to have a 4.0, but you have to have a pretty good standing, and then you have to do good on the test. And if they select you, then you go on to vet school, and that is 4 years minimum.
Minimum?
Minimum. Mm-hmm. If you wanted to do specialty stuff, get a residency or internship in internal medicine or something like that, you can go on and do that, but that's another at least couple years, if not 4 if you do a residency, or 8. So you could go to school a very long time if you wanted to.
So you're like, what, 85 now? Is that
Yeah,
what
pretty much. I just did the minimum. I wanted to get out and make a little bit of a paycheck, start paying off the loans.
It's a commitment, though.
It is. Mm-hmm.
I see why you guys make the big bucks.
Oh.
You guys put the time in.
I think, last I knew, I think dental hygienists get more paid than we do starting out, and they only go to school for 4 years.
You just crushed a lot of kids' dreams that want to be a vet. They're now going to, Mom, I need a new toothbrush. I need some dental floss.
Do it. They do pretty good. 8 to 5, no after hours. No, it's not bad, but the loans are pretty intense. So unless you've got to be prepared for that or work a lot. But yeah, I've still got some loans. I probably would be done, but we've had some kids and we took advantage of the forbearance
just
stuff
a couple.
for a while.
You just had another one.
Yeah, we did. Mm-hmm.
Which, congratulations.
Thank you.
All your boys are so cute. They're adorable.
One wanted to come really badly.
What are some of the challenges of that job? There's got to be a lot.
There are. Probably there can be very variable challenges. Some of it is the people you come across too. Everyone's got different feelings about different things and how they want things done. Right. So you've got to learn as you go with those things. It's not something obviously you learn in school. So you have to learn how to work with people with what they're financially as well as emotionally capable of. There's a lot to play into there. Some of the other challenges too are they prepare you pretty well in vet school, but they more or less teach you where to find stuff, where the resources are. So you may come across a case or not have any idea what's wrong with the pet, and sometimes it's a challenge and takes a lot of looking up into things or different tests to get you towards your answer. But those are some of the challenges.
To people more.
Yes.
And I'm sure the animals too have their own personalities that come in. And you having to be hands-on, obviously, with all these animals. Some of them are not socialized well or used to being handled. And so I'm sure that's a challenge for you as well.
Yes. Thank you for helping with Paws and all their recent adoptions, by the way, because it helps to have those dogs at least go through some training. I hope they take you up on that.
A little bit of love. We do have a couple already. They have their consult set up, so I'll be seeing them. Do you have a favorite animal to see as a patient?
I like the dogs and cats, probably the smaller dogs because they're a little easier to handle. Especially when you get the ones that don't want to be in the vet office, or the smaller ones, or even if they're not happy about being there, they're a little easier to manage. But I like them all. I told you that there's a breeder in town that does Great Danes.
Yes.
So she's got some 150-pound dogs that are
150?
wonderful. Mm-hmm.
Wow.
Yep. And then we had a 200, I don't remember what he weighed, almost 200-pound Great Dane we did a surgery on a couple weeks ago. So they're fun. That Great Dane we kept, he came in the Wednesday before Thanksgiving. I called the other vet in because we already had appointments, and they came in the afternoon, and he needed a surgery done. So the other vet came in, but we kept him overnight. So I come in Thanksgiving morning, and I let him outside to go potty, and I tried to get him back in the kennel. I cannot get this 190-pound dog in the kennel. So I called the owner, and the owner came and got him, and he ended up doing fine. We would have met him up there again if needed, but yeah, you can't push a 190-pound dog when you don't weigh as much as him.
Yeah, that would probably not go how you would want it to go. I can see how the size and the breed of the dogs could be challenging. And the people too, and you know, you're a doctor and sometimes you have to deliver not so good news. So I'm sure that's difficult.
It sure can be, especially you've developed relationships with these people over time, and their dog comes in not feeling well, and you get some answers via blood work or whatever, or feel something that shouldn't be there, and you gotta tell them that we're
not so good news.
Yeah.
A lot of these animals are family. I know mine are. I chase them around the house like they're little kids half the time. So it's, you know, and they're with you for years. So you develop that bond with them. And so, you know, I just lost Arturo. So you get that bond with them, and then it's really hard when it's that time to let them go. But to be that person that has to deliver that information is...
Yeah, and it's hard, especially we over time get to see, if we've seen them over the years too, even though we don't see them every day, we get a little attached to them as well. But yeah, they don't live long enough. I've heard that there's this new growth extender coming out. I don't know if that's going to really play into much or if it's going to be worthwhile, but it's supposed to help some of the bigger dogs live longer potentially.
What is that about? Do you know, like what do they mean by growth extender?
We all have growth hormones in our body, and it's supposed to slow down the progression of growth over time on those big dogs especially.
Is it like a medication that you would give them? Or?
Yeah, it's an injection.
That's crazy.
It is.
It's crazy to think. I mean, it's kind of cool, I guess, in a way. I'd be like, I want 20 million people to try that before I give it to my dog, though.
Yes, everything comes with a risk for sure.
I think I'd ask you, the respiratory illness, they're calling it the mysterious. Do we have any of that here in San Angelo? Have we seen any?
Not that I've heard. It's supposedly it's similar to kennel cough, and if you have a healthy dog, it should do fine. They'll cough for a couple of weeks, and then they get over it. It's the ones that kind of have a weakened immune system, an older dog with other comorbidities or
This
diseases.
is like COVID for dogs? Is that what?
It's similar, yeah.
Our dogs are going to be wearing masks pretty soon?
Yeah, the young puppies, that sort of thing, potentially can develop pneumonia, but they haven't figured out what it is, if it's a virus or a bacteria. But again, most of them, without any care, tend to do well. Maybe
Just
some
resolve on
supportive
their
care.
own.
Mm-hmm. Yeah, the ones that do get sick, sounds like most of them do pretty well with supportive care for pneumonia or whatever they end up getting secondary to the bug.
What are some, can you think maybe one or two of your patient stories? I obviously don't have to give names or anything, but really happy, like something that you did or were able to resolve or alleviate the animal or even save their life that you could share, like just some cool war stories.
You got me thinking of the older animals. Some people will bring their dogs in, and a lot of dogs get arthritis when they get older, and they'll bring them in, and they're about ready to, they've been thinking about, is it time yet or not? And their dogs have maybe been on glucosamine or nothing at all, and we put them on these meds, and we'll give them some more time with them. And even if it's a few months or a year, that makes a huge difference. So it's nice to hear the appreciation and, oh, we're getting around better. Thank you so much. The dog's feeling so much better. And I think sometimes some people don't realize that some of these things we can do to help these guys out just a little bit in the end. She said their family. And so I think that's something we see. Or another thing, too, is these little parvo puppies that come in, and these people don't realize about vaccines, or they haven't didn't realize they had parvo in the yard or tracked it back home or what have you. And you get these young kids that are attached to their little puppies. We recently had someone gotten a little puppy. They had it about a month, had not gone outside, and no way it could have gotten parvo. We check it a couple days later. The test says it's positive. And there's no guarantee with that. But they do now have this new injection, this monoclonal antibody stuff we give, and that puppy within 24 hours was feeling better, and they were so relieved because they were worried that they were going to lose this little puppy they had gotten so attached to over the last month. So it's rewarding to see these guys. But we get these scary moments where you don't think the dog's going to make it, or it's got a very shortened life ahead, and we can extend it, and it's very rewarding to see that.
Parvo is pretty bad, as I'm from New York, and I honestly never even dealt with it. With my dogs up there, and then I came here and everybody's like, watch out for parvo. I'm like, what is that? And then the shots, and it's a 4 series or 3.
Every clinic is different. Most in town here do a series of 4 boosters when they're real young. If we don't see them till they're a little older, we may only do a couple. But usually we try to get them started about 6 to 8 weeks, and they get a shot every 3 weeks until they're about 4 to 5 months old. If they hit a little older, sometimes we'll do 1 and then possibly a booster.
It's crazy how big that is here. Maybe it's not crazy, but to me it was.
No,
it was a shock.
Back in South Dakota, I remember I had just gotten out of vet school and went back there for a short time, and we had there's a reservation close by, and I was pretty sure we had a parvo dog, and we had to go to the one emergency clinic in town to get a parvo test. And now everyone in town here has parvo tests.
I don't know if there's one single thing about your career that you love the most, but if there is, what is it? What do you really love about what you do?
I like helping the people.
The people?
Yeah.
So the same thing that's the most challenging for you is
Yes.
also the most rewarding.
Yes. Yeah. Even people that bring in their feral cats that you can't really handle and making them better. It's all about the people, honestly.
What is the strangest animal that you've had under your care that's come in?
A long time ago, I did surgery on a chameleon.
Really?
Yes.
What kind of surgery was it?
It had gotten these little, they call it egg bound, or little, I think, follicles, had these little egg follicles that it wasn't able to pass. And I don't remember how exactly it works out, but we had to go in and basically spay a chameleon.
Really? Mm-hmm. That must have been like what? How big is the incision for that?
Yeah,
like
just about, yeah.
Like
maybe an inch, if that.
It's like a plain operation.
Yes.
You know, the little game where you go in and you only have a space that big.
Yeah, sometimes you need little magnifying glasses for that sort
Really?
of stuff, yeah.
Down. Yeah. That's crazy. Yeah, I know we had one of the groomers. She worked at a vet's office early on, and she was talking about an iguana spay and neuter. And I didn't even know that people did this with lizards. So that was pretty neat to find out. But a chameleon, those are the ones that move all weird, right? They change color.
Yes. Mm-hmm.
That's pretty cool.
The way that you sometimes.
Yes. Oh, they do. Right on. Is there anything specific that you would want to put out about anything involving their pet's health needs or care?
Biggest thing around here is still parvo. So if you've got a young dog or haven't kept up on your vaccines and you have a relatively young dog, you might want to make sure they're up on their boosters. I think that's the biggest thing. If you're not going to breed your dog, probably good to spay and neuter so you don't run into cancer, or we call it pyometra, where they get an infected uterus down the road. There's lots of voucher programs through different rescues out there to help you if you're not able to afford that. If they run into a pyometra, that's a life-threatening thing.
So the females?
Yes, the females, yep. The males, it's not common, but they can get prostate issues and potentially testicular cancer, but it's not as common as we see the females have the reproductive things that tend to be more scary. They will get breast cancer, and that can sometimes be a little more aggressive, so reach out to those rescues that have those voucher programs. There's usually someone willing to help you get those animals fixed.
Just do it.
Yeah.
What age is it health-wise? Do the dogs need to be fully developed before they're spayed or neutered? What is the age frame that you typically recommend?
Depends on the breed. The smaller dogs, we tend to do about 6 months. Sometimes in the rescue type situations, we'll do them younger so they can get adopted out. But the larger breed dogs, there are some studies on specific breeds. Not all breeds have it, but Golden Retriever, for example, they may say wait a year till their bones are a little more fully developed, because there is a role of the hormones in both bone closure. So we like to have those bones closed before they're ideally spayed and neutered. Again, the smaller dogs mature sooner, but if you got a big dog, if you got like a big Great Dane or something, we may wait till they're 2 or so before we do that. But again, it just varies. The rescues try to get them adopted out, and they need to be spayed and neutered before
Right.
they hit the road there. So it's variable.
Okay. Well, I had 10 questions, but I just asked you one about spay and neuter. But I have 9 questions that are typically asked to vets or that pet owners would like to know. Do you mind if we ask them to you? All right. So the first one is, why do dogs eat grass?
Sometimes they do it because they're bored. A lot of the puppies will. They like to experiment with things. It also can be a sign of GI upset. So if your dog is eating a lot of grass or doing it on a continual basis, sometimes you may need to try a different food or some kind of treat possibly is setting up their GI tract. But sometimes they just do it. But if they're doing it continuously or excessively, again, can be a sign of a little tummy
Something's
upset.
upset. And then I have one more eating question is, why do some dogs eat poop?
We don't really know.
Is it bad? Can it be stopped? You know, like what is
Usually
the
some
deal
kind of
there?
psychological thing there. It's not because they're deficient in anything. You can try to stop it. I've had a dog of our own that had done it in the past. There are things that clinics sometimes called something called forbid. You could probably even get it online. You can try meat tenderizer recipes or pineapple juice, and any animal that is eating the poop ideally has to get that so that their poop tastes gross. But again, you can maybe get it fixed for a while, but it may come back. There's just
It's just
no
something.
guarantee.
If we talk about pet food, is there a specific type, like dry, kibble, wet food? And I've heard like raw diets, freeze. There's all different kinds. Is there anything specifically you prefer or recommend in general for dogs?
We tend to lean towards the kibble, a good brand kibble, not the store varieties, but like Science Diet or Vapor Purinas or Royal Canin, some of those types. The raw diets are having come through. The only issue with those and where we get concerned about those is you have to watch for bacteria. You have to make sure you're getting them from a good source. They're handled well, because a lot of times there's recalls with salmonella or listeria or things like that. So that's the biggest thing. A lot of dogs do thrive on the raw, but you have to be very careful. Kibble is good too, because it's crunchy. It usually helps a little bit with their teeth. But again, you want to avoid the store brands. They're the ones that tend to get recalled more often. And then canned food can be good too, as long as it's a good brand. You just have to make sure that you're trying to do dental care as well, because it doesn't have the crunching action to remove some of that buildup on their teeth, so they tend to get tartar a little easier.
That kind of leads into one of my other questions, which is, what is the best way to keep your dog's teeth healthy?
Brushing if you can. A lot of people struggle, their dogs won't let them do it, or I personally don't have time. So if you can brush your teeth, ideally, if you could do it 30 seconds to a minute every day, every other day, anything's going to help. If you're not able to do that, your dog won't let you do that, even if you ideally start young with them. And if your dog still refuses, there are some water additives. Some of them have or chlorhexidine, something like that in there that'll help decrease that bacteria buildup in the mouth. There's some rinses you do too. So you rinse their mouth with this special additive and then don't let them eat for 30 minutes after, similar to after we go to a dentist to help prevent that. But there's rawhide chews that have stuff that are supposed to decrease the plaque tartar. Many of the dental products, greenies are okay. You just have to watch their high calorie. But yeah,
So greenies could make fatties? Is that
yes,
right?
it can. Yeah, one time I looked those up. The big ones have like 500 calories.
Oh, wow.
Yeah, I think they're the larger extra large.
Wow.
Yeah.
Like
yeah.
what? In the warmer months, you see a lot of people, they take their dogs to the groomers, and these huskies or the shepherds with the undercoats, and they shave them. Is that okay? Is that bad for the dog? Because I've heard that can actually make them hotter. Is this...
Yeah, that double coat technically has a little protection for them. So if it was really hot out, they might not be as protected against the elements. Ideally not shave them. If they're indoors all the time, it's probably not going to matter. But their coat can grow back funky too. So we usually don't recommend it.
Don't shave your huskies, guys.
No.
Don't do it. Just ask for a trim off the top. How many times a day should you feed your dog?
It depends on your dog. Some people, especially some trainers, will divide up their food into giving their kibble throughout the day to kind of
training
as
instead
training.
of treats. Yeah.
As long as your dog gets the proper number of calories, dogs can often go eating once a day. The young puppies, especially the small breed puppies, they do need to eat ideally 3-4 times a day, like the little teacup chihuahuas that are little babies, because their blood sugar will get low. But if you've got a adult dog, they can often just eat once or twice a day. It just depends on your schedule, honestly, and how you want to do that.
So one way is not really better, because I tend to feed all ours twice a day. But I've also heard like, oh, you should only feed them once a day. So I'm like, is this just somebody else's preference, or is there a reason for?
No, as long as they get their calories through within the day, they should be fine.
Either way. Okay, the dog's nose, wet or dry? What should your dog's nose typically be, and why? How does it affect their health?
It should be a little wet. You don't want it to be snotty, but you want it to be a little moist. That kind of just lets you know that they're well hydrated. Sometimes some of the older guys that start to have issues, sometimes they don't have proper tear ducts or something like that. They will get a little bit of a dry nose, but if you're concerned at all, you can always check their gums if they'll let you, and if the gums are moist, it's good. But ideally, your dog should have a little bit of a wet nose, and if you have any question, again, if they'll let you touch that pink part of their gum, if it's pink or brown or whatever color, and as long as that's moist, oftentimes you are fine. But a dry nose can sometimes indicate dehydration, but again, sometimes there's other factors that can play a role.
In general, how much exercise does a dog really need a day, and does their breed play a role in that?
Their breed does play a role. Some dogs are going to be way more energetic. You've got a couple of energetic shepherd type dogs, Belgian Malinois and your Dutch Shepherd. But it honestly depends, and I know a lot of people, it depends on their lifestyle too. Some people aren't able to get out, and when it's really cold or really hot, we don't want them on the hot pavements, or they're short-coated dogs. We don't want them out in the real cold weather. But it depends too on their weight. Sometimes we recommend exercising a little more if they're on the heavy side. So it ultimately just depends. But these young, active, especially the dogs that are bred as shepherds or pointers or healers, any of those types of breeds, they're meant to be a working dog. So if they're not out and working, you need to help burn their energy by doing some kind of exercise activity, whether it's just throwing a ball or going on a jog, a walk, a run. You do have to be careful. Some of the young growing animals, they do recommend not to overdo it, because you don't want to overdo cause like a stress fracture or anything if they're running too hard when they're real young. But your average dog, it tends to depend on the breed and age and activity level.
So life is all about balance, is what we're.
Yes.
Yeah. And my last question, what are some key signs or symptoms that a pet may be in distress and require immediate medical attention?
I would say if your dog is not moving, and again, it can vary depending on what's going on too, but if they're normally moving and they're not moving today, or they're not wanting to eat and they're normally eating, if they're breathing rapidly, their chest is moving different than normal, any of those things, if they don't seem like they're really with it, normally they're pretty responsive to you. Any of those things can be a sign you want to bring your animal into the vets. If diarrhea is going on, especially if it's bloody or it's been going on for several days. They can go without food for a couple of days, but usually you should still bring your dog into the vet to have them checked out, make sure there's nothing major going on there. Any signs of continuous vomiting. Sometimes I'll vomit on occasion here and there, but if it's persistent or been going on for quite a bit, it can indicate a blockage or different things like that you need to get to your vet as soon as possible so we can fix those things. Those are the biggest things. They will let you look at their gums too, if their gums are abnormal colored, so if they're white or purple like that, they should be pink. But again, if you have like a chocolate lab that may have some brown gums or something, take that with a grain of salt, but they should be kind of pink. But if they look more pale or even yellow's not a good sign either. Any of that, you probably want to have them checked out, or if they're moaning or groaning in pain, could be another sign of some kind of distress as well.
In general, if you notice anything out of the norm, you know,
Yes.
like their behavior, or they should make an appointment as soon as possible to have them checked out. Well, I think I picked your brain a lot. How much are you going to charge us for this session? This session.
You just keep taking those obedience classes for those paws dogs.
Well, thank you for taking some time out. I know it was hard. I harassed her for what's been a couple months to try to get you here. So thank you so much for sitting down with us and just answering some questions and taking the time out to do that. We really appreciate it.
Thank you for all you do with the community. I know you were doing quite a few little sessions to help people out that had no training with their dogs or were seeking training that maybe didn't have a lot or just wanted some guidance. So thank you, because all of our dogs can use training.
Training is good for their mental state. Sometimes the mental stimulation too is just as important as the physical. I think people tend to forget about that because they see the dogs are antsy and they know they got to do something, so they take them out on like a 5-mile hike. But sometimes engaging them mentally for 5 minutes as a vet, do you think that that's something too, that mental stimulation?
Absolutely.
For the dogs?
We've got a year-old Vizsla, and she's crazy. But if I take her to class, she's just as tired as if we had gone for, I don't know, a mile walk. So
Working her brain?
Yes, and they tend to be better animals overall, I think, if they get training, as you're not yelling at the dog about, I don't know, jumping on the furniture or chasing the next door neighbor's cat, or just training in general helps them be a better dog. They're a happier dog. They're geared to please. So if you're doing training, they're there to do what they're supposed to do.
Awesome. I mean, I agree.
And most important question, how'd your ZD turn out?
It's good. I ate some right before I came, actually, leftover. So I'm probably eat it again for dinner.
Are you Italian?
Yeah.
Yeah, so it was
My last name is Bruno, so
Yeah, I
I'm from New
figured so.
York. So there you go. Are you Italian?
No.
Do you like ziti?
I have
could
not had
bring
a
you
lot of real
guys
good
some.
ZD.
No?
You should bring some.
That's because you haven't had New York ziti. You've had Texas ziti? I love Texas. I do. But yeah, you don't see a lot of true Italian down here.
No.
But
What'd you get for Christmas? Anything good?
I do. We do have another dog in the house who might be coming to see you shortly. I can't really disclose too much information about him just yet, but yeah.
Good.
So I guess you could say we got another dog for Christmas.
Well, this town and all the dogs, there's a lot of them.
Yeah. I mean, I think the stray thing just now in general, like it's a nationwide thing, I think.
Yeah.
I don't know. I think maybe COVID played a part in that somehow. I don't know. But it's bad everywhere. San Angelo's is pretty bad, but it's bad everywhere right now. I know a lot of the shelters having an issue with that, but yeah.
Adopt? Adopt.
I don't know. I do. Yes, if you can adopt. You know, and I never like knock people that don't either, that choose to go to like a reputable, ethical breeder instead, because there are reasons to pick that over adopting. It depends what your need and want is for a dog.
Right.
You know, so adopt or shop responsibly is what I would say. But yeah. I mean, I'm sure the rescues are like, fully shop right now. What are you doing?
No, I think they're the same.
All right. I think we're good. We talked a lot.
I hope I answered the questions right.
There'll be a test later because we don't think that Dr. Feller had enough tests in her 20 years of schooling.